Hi, I'm Paulette Kamenika, and I'll be leading you with my colleague, Dr. Geetika Patel, through this video series geared to you, the partner of the birthing person, to try to make the postpartum period more manageable. And I will try not to speak so quickly, although that is not my strong suit. We're going to talk about the most common serious postpartum complications. We'll cover what they are, what are the possible issues, why they're an issue, why they're so important, and what you can do to help your partner address them if they do come up. To start, what are the serious complications of postpartum? So here's a short list. The first is hemorrhage. That's heavy bleeding after giving birth. The second is sepsis, which is a serious infection affecting multiple organs. The third is versions of hypertension. Hypertension is high blood pressure. It can also present as preeclampsia, which is high blood pressure linked with protein in the urine during that spills into the urine during pregnancy, or eclampsia, which is preeclampsia with seizures. Another issue is pulmonary embolism. It's a blockage in one of the blood vessels in the lungs that carry blood from the heart to the lungs. Blood clots often travel to the lungs from the legs. Another issue is stroke, a blood clot or bleed in a blood vessel in the brain. And the last one on this list is psychosis. It's altered mental state marked by hallucination and delusions. And it can cause a person to be suicidal or homicidal. So these are some of the serious things that we're looking out for in the postpartum period. Why are these conditions important? There are a lot of changes occurring in your life and your partner's life in the postpartum, and this can include serious complications for the birthing person. Some of them are even life threatening. Pregnancy related deaths are defined as deaths that occur during pregnancy or up to 1 year after birth. It took 9 months to have all these physical changes create another life, and it takes a fairly long time for them to wind down, and a lot of things can happen in that process. More than half of pregnancy related deaths occur in postpartum, and more than 60% are preventable. Now, there's some issue about whether the mortality rate is on the rise or not, and that's a tricky thing to unwind. Uh, Across states, there have been different standards that have been used over time to define pregnancy related death, so it makes a dynamic measurement kind of tricky. But whether it's on the rise or not, it is an issue, and it's more common in African American and Native American communities. But note that this can happen to anyone. But there are things that you can do to prepare yourself for this period and to figure out how to deal with an issue if it arises. The first thing to do is to know the risk factors that your partner has. Do they have hypertension or obesity, heart disease, diabetes, depression? All these things make complications more likely. So it's important to know your partner's medical history going into pregnancy. It's also important to know if a problem arises, if it's the type of problem that you should bring to the ER. Some signs and symptoms qualify as an emergency, and you should go straight to the ER and call your doctor while you're on the way if your partner is showing any of the following symptoms: chest pain, shortness of breath or trouble breathing, extreme tiredness that doesn't get better with rest, seizures, or thoughts of killing herself or others. These are things that require an ER visit. Because birth is such an enormous transition for the body, there are other things that can happen, and these things may require a call to the doctor. So know when to call the doctor. Here's a brief list of the things that might trigger a call to the doctor. Bleeding that soaks through more than 1 pad an hour, or passing blood clots the size of an egg or bigger. A cut from surgery that isn't healing, that continues to bleed, or the skin is not coming together. A leg that has changed color or swells and is painful or warm to the touch. A temperature of 100.4 Fahrenheit or higher. A headache that doesn't get better even after taking medication, or a headache with vision changes. And more than one blood pressure reading of 150 over 100 or greater if you're measuring your blood pressure at home after giving birth. If you see any of these symptoms, call your doctor and have them advise you on what to do next. We don't have control over whether one of these serious complications will visit your partner, but what we can do is prepare for that possibility and know how to handle it if it does arrive. So, one thing to do again is to recall if there are any of the risk factors that we mentioned earlier that your partner brings to pregnancy. After the birth, check in with the medical team and see if there are any additional risk factors or if something occurred in the birth that created a condition that you need to be aware of. Know the signs and symptoms of serious conditions. Make sure your partner attends all the postpartum visits that are scheduled after the birth. And if you are unsure or worried, in any case, reach out to the healthcare team and they will give you guidance in your specific position.